effective sensory diet. This topic is of immense relevance in today's context, as many children with neurodevelopmental differences struggle with sensory processing challenges that impact their daily functioning and social emotional development. It's a privilege to have him with us today. Welcome, Dr. Bagga.
Hi, thank you. Thank you for calling me here. And it was a very nice introduction. I think maybe itna acha nahi de pata, so thank you very much. Um, it's a great honor for me. And I'm a person who talks a lot, and my wife says I'm also a very hyperactive person. So I think I will be able to justify to talk about the autism here, and let's see how we begin. So actually talking about the sensory and the topic which has been given to me, let me tell you, it's a topic in which I can speak for days and days and days without stopping. So unfortunately, we just have 45 minutes of our time because we also have a question and answer section. So let us begin with it. And I will try to make you understand the things. And I was really excited when I was given a topic sensory diet, because this is the first time I think in this international forum I'm going to talk about the sensory diet, and I hope there are a lot of professionals listening to me here because it's their duty to make that diet for the kid. Okay, so let me start with my screen sharing first, which I think somebody has to help me because I'm very bad in technology, but we have tried it once. So let me see if the things are going good. Yeah, so is it fine?
Yes, sir, Roshan, it's fine.
One thing before beginning this PPT or this thing, I would see this PPT is for me. It's for my reference. All you need to is to listen to me carefully for 45 minutes. That's it. So just don't go for the languages and the words which I've written here. Okay. So before we begin, I'm not going to waste the time in saying that what are the senses and how the senses work. Okay, because we all know about the senses. But when we talk about the senses, you can see the taste, smell, vision, hearing, touch, which we all know. But I have written here two hidden senses. One is the vestibular sense and one is a proprioceptive sense. Okay. Now, the question arises why I have said it as a hidden sense. Why is the vestibular and its a proprioceptive sense a hidden sense? One of the reasons why I call this as a hidden sense is because all the other senses, including the taste, smell, vision, hearing, and taste, these all senses are actually absorbed from the environment. So we need to see something in the environment. We need to smell something in the environment. We need to hear something from the outside. But these two systems, the vestibular and the proprioceptive systems, are the two systems which is not present in my environment. It is actually present internally. So that's the reason we have said it as a hidden sense. Okay. So the primary sense which I really want to talk about here is just a three sense. No matter if the child is having a verbal stimming issues, no matter if a child is having any sort of auditory issues, no matter if the child is having a smell issues, the primary sense I want to talk about is the tactile, the vestibular, and the proprioceptive. Okay, so this is the most important thing which I actually want to say. Now, let's go to the other slide. I don't know how I'm going to do it, or do I have to? Okay, fine. Okay, so before we start with the sensory diet, or before I just start explaining about the sensory systems isolately, let us talk about sensory regulation. Now, what is the meaning of sensory regulation? Now, look at yourself right now. All of you are gazing in the screen, listening to me. All your auditory sense is actually stimulated right now. And you can see, while maybe listening to me, you are nodding your head also. Maybe you will go and change your positions in between. And this all is happening in an unconscious level, isn't it? We are not even bothered about what is happening in our environment. So this is known as sensory regulation. So right now, as an individual, you have prioritized your goal. Okay, we have to listen to Bagga. That is what your goal is. So any other distraction going around your environment, it's not bothering you. So that means you are sensorially regulated in a sense that you are able to control your senses and you can use the exact primary sense you need to use right now. That is the auditory and the visual sense. Okay, so this is known as sensory regulation. So if we talk about an autism spectrum kid, or maybe if we are talking about any special kid, this is a major problem they have. Sensory regulation. They are not able to regulate themselves. Now, because as they are not regulate themselves, they are more bothered what's happening outside, what's happening up, who is coming, who is going. Maybe they have some problem like stimming, which is coming internally. So they are not able to sensory regulate themselves. Now, the problem is that when you are not able to regulate sensorially yourself, you will not be able to do the things functionally. So your functionality will get hampered. This is the reason that it's very important to regulate the child. This is the primary thing which every therapist, every parent should know. Now let me give you a simple example. I have visited lots of centers and I have tried to train a lot of parents. One basic error which I basically see with all the not all the therapists but the newcomers and the parents is they become over ambitious. They are not even bothered whether the child is looking at them. They are not even bothered if the child is interested in that activity. They themselves wants the kid to do that thing. And in that case, what happens that they do lot of sensory overload. Let me give you an example because I think it's better to understand the things with an example. So supposedly, if somebody has come to me and I don't have any experience working with the autistic kid, parents came and they told me, okay, you know what, my child is not giving an eye contact to me. So as a therapist, I'll say, today I'm going to take an eye contact from the kid. So I'll just make him sit in front of me, no matter if he's interested or not, and I will start shouting. Dekho, mujhe dekho, 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 very good, yes, 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 very good, very good. So what happens is you put lot of overload. And because of that sensory overload, the child is not able to regulate himself. So this is the primary thing which I actually want to request all the professionals and the parents to see. Whenever you are working with the kid, you need to see whether the child is regulated or not. Okay. Now, when we talk about sensory regulation, the question comes, why is our kid not regulated? What is the problem in the sensory system due to which the regulation is not there? Well, the answer is basically, if you're going to ask me, this slide will really explain you the things better. The only problem why the child is sensorially not integrated or is not responding, or the reason is sensory processing disorder. Now, again, we all are educated. We all know what is the meaning of processing. So I don't want to go into the depth of it. It's just like a computer. So you need to put some input in the computer is going to process it and it's going to give you the output. It's a very simple definition and the best definition. So the problem is either the brain is not able to take the stimulus properly from the environment or from the sense. Okay, so that is the problem. Or maybe if it's taking that sensory input, it's not able to process the things. So in both the cases, if the sensory stimulus going to the brain is not going properly, or maybe if the sensory input is going properly, but the brain is not able to process that thing, you will never get a perfect output or a functional output. So this is known as sensory processing disorders. Now, here I want to introduce two words basically. One is hyposensitivity and the second is hypersensitivity. Now, again, let's talk about a dog. We all know that the dog can hear much, much, much better than us as a human being. Okay, so the dog's hearing sensitivity is much higher than us. That's a different sort of an human beings. Every human being has a range. We have a threshold through which we can hear or we can smell or we can listen or we can see. Let me give you an example. We can hear from 20 hertz to 20,000 hertz. So any sound between 20 hertz to 20,000 hertz, as a normal human, any human will be able to hear it. Hearing here means that hearing and process that thing properly. So any sound which is below 20,000 hertz or which is above 20, which is below 20 hertz or maybe above 20,000 hertz, we might be able to listen to it, but we will not be able to process that what is basically that sound is all about. So as a human, we have a threshold. So our every sensory system has a threshold in which we all as a human respond properly or we respond normally. Now, with the autism spectrum kids, or maybe we should say that with the sensory processing disorder kids, the problem lies the threshold of those kids are either on the lower sides or it can be on the higher side. Like what I want to say is maybe the sound of the fan is not disturbing you, but for a child who is high sensitive to sound, it might be like a loudspeaker. So it can be just be like a loudspeaker. So imagine if just a small sound of a fan or maybe a sound of the bird is really disturbing me in a sense that it is just like a loudspeaker. So that comes under hypersensitivity. So this is a major problem which our autism spectrum kids are basically having. So that was an example of an hypersensitivity. But let me come to the hyposensitivity in the kids. Surprisingly, last week there was a child who was not coming to my center, and my coordinator called him that why he is not coming. The parent told that he had a fracture. The unfortunate part is that even the kid didn't know that he had a fracture. He was not even feeling any sort of a pain. It was just when he slept at the night, when he woke up in the morning, the parents saw the hand, it was swelled so much. Then they rushed to the hospital, they did for the x-ray. So that is the low threshold. That is a hyposensitivity to the pain threshold. So our kids, the autism spectrum kids, or maybe I'm again going to use the sensory processing disorder kids, can range to the hypersensitivity or hypersensitivity. So that means if my sensory system is not working within that normal human threshold, we have to intervene it. We have to do something about it. So this is basically all I just want to know. So I just going to change my slide. So again, you can read about it. I've already explained you the things that the child may be under responsive to the sensory stimulus, maybe over responsive to the sensory stimulus, or maybe he seeks for the sensory stimulus. I hope this thing is really clearing the things to you. Now, before moving further, I know I'm very fast because I think I just have 45 minutes. I have to explain lots of things. When I started my workshop, you know what? I told you that here I'm just going to talk about three primary systems. One is the touch system, one is the balance system, and one is the proprioceptive system. Now, why I call these three systems a primary system? Because all the other senses are basically dependent upon this sense. Let me give you an example. So supposedly, if somebody is sitting and he is having a wallet in his back pocket, so suddenly if I say, okay, without touching, can you tell me whether you have a wallet in your back pocket or not? You can feel it and you can tell me, yes, I have it. So the tactile system is basically the system which is a primary system which gives you the awareness of your skin and your body. Now, surprisingly, the tactile system is a system which replaces the visual system. Again, if I talk about a blind person and if he needs to read, we know about the braille, isn't it? The braille is that where they can just touch the things and they can read the things. So that means why visual is not a primary system? Because if my touch system is poor, definitely my visual system is going to get hampered. So if imagine, let me give you an example of a child who had a fracture. So if my touch system, because the problem is that his touch system is not so strong. So he was not even bothered to look about his fractured bone. He was not even bothered to look about the hand where the things were fractured. So as my touch system is not good, my visual system is not going to get integrated. So if you want to work on the visual system, you have to work on the touch system. So that's the reason touch is a primary system where which we have to work. Now, let's talk about my second, and which is my favorite system, which is known as vestibular system. Well, vestibular means a simple balancing. Let us make it very simple. A simple balancing things. Here, how many autistic kids actually skip their milestones? When I try to assess them, I can assure you 6 or 7 out of 10 autistic kids skip their even 1 or 2 milestones. And the most common milestones which they skip is a crawling or kneeling. So what happens is basically when the parents come to us, they have a mindset ki, okay, my child was able to walk in a year. So that means there was no delay in any sort of a milestone. So when I try to assess the kid, and when I asked, did he crawl? They were very confident. They said, yes, sir, my child crawled. So nowadays, thanks to the camera, so I just tell them, can you show me the videos? When I see the videos, actually crawling is not that what they are doing. Either they are doing some sort of a frog jump or they are doing some type of a boot squat, something like that. So what does this indicate to me? So this indicates their balance system is not good, because before walking, all your milestones have to get achieved, because that will give you an awareness of your space. Now imagine I'm just sitting like this. I know how much I can bend without looking back. How am I able to do that? It's because my vestibular system is giving me the knowledge about my space. What is a safe space for me and what is a dangerous space for me. So the kids who are in the autism spectrum, maybe because of the hyperactivity, they have a very poor knowledge about their space. So this is the primary thing. The vestibular system is the second primary system, which I really want to tell about, that this is where, as a parent, as a therapist, we have to do it first. Okay. So now, the third system is a proprioceptive system. You know what? We all are sitting in front of our cameras, but I want all of you to do one test. Let us do something. Okay. So all you need to do is just move a step back. Maybe if you're sitting on the chair, just move a step back. Okay, or either if it's possible, you all can stand and do this. So you need to imagine something. Okay, you need to imagine something. You have to imagine that you have 50 kg of a sack. Okay, it's a very heavy sack which is on the floor. And I'm giving you a command that you have to pick up this sack and put it on the table. So how will you do it? I can see very few pictures, but I want everyone to do it. So show me the actions, how you're going to do that. Nandita, I can see you, so I just can see you. So I just want you to do that. How will you do that? It's a simple example. A 50 kg of a sack. Perfect. So now my question to you all is any sack present? No, there is no sack. Then why all of you use your two hands? Why did you do that? There is no sack present here. Why didn't you do this? Okay, I picked up like this and like that. Because now look at the beauty of our brain. There is no weight in front of us. There is no sack, a big sack in front of us. But still, we did an action of exactly the same, that how we are going to pick the sack. This happened just because of your proprioceptive system. This happened because your brain exactly knows the level and the power of your muscle. So it was just an auditory stimulus which I gave. Now look at the beauty of the brain. It processed it, and the process was so good that brain commanded the muscles, okay, we are talking about a big sack. You cannot pick it with your one hand. And remember, it's a 50 kg sack. So no matter, it was not a 50 kg pack, but the tension in your muscle, which was generated by the brain, was actually of a 50 kg. So this is proprioceptive system. So this means the muscle and the brain exactly know each other's level. This is a neuromuscular connection, and the beauty of this is that this happens in a subconscious level. Now, how many of you are just moving like this, maybe like this, without knowing that you are moving? You know why this is happening? This is happening because when you are sitting in one place, your muscle is getting tired. So the message is going to the brain. The brain is saying, fine, you are tired. Okay, you just keep on doing your work. You just keep on listening to Dr. Bagga. I will do all the adjustment to the posture. You don't focus on your muscle anymore. So automatically in the semi-conscious level, you will change your posture. So that is why the proprioceptive system is so important. Now, let me relate this proprioceptive system with the autistic kids. Are our kids able to sit properly in one place? No, they are always keep on moving. Maybe there is like a lot of autistic kids have a very low muscle tone. So if you will give them something and if you will tell them to, okay, you need to raise your hand holding something, they will do just like this. They will not be able to bring their hands completely up. Why? Because their proprioceptive system is not working properly. Okay, so that is the reason. Again, I'm saying these are the three primary systems, the tactile, the vestibular, and the proprioceptive systems. The moment you don't have any awareness about your body from inside, no matter how much you are going to work on the auditory systems, the visual systems, or maybe on the sensory or stimming things, it's not going to work for us. Okay. So that is one of the things which I want to explain. So I hope you really understood the three primary sense I want to talk about. Now, as I have earlier talked about the hypersensitivity and the hyposensitivity, so all these three systems, let me talk about what type of a problem the kid can have. You know what? What I believe is that whosoever is sitting in this conference, they are actually having a minimal amount of knowledge about the sensory system and the autism kids. So that's the reason I'm not going to the at the lower level or maybe on the basic level. I'm just keeping it on a little bit step ahead. So, how will we say the child is overreactive? So, when we are talking about overreactive, we are talking about hypersensitive kid. A kid, maybe a small touch to that kid is making him really very uncomfortable. So, how you can know about it? So one of the reasons is that these kids are very irritable. So these kids are the kids who really prefer to be on the lap of their mother, or they just want to be around their mother. So if anybody will come and will try to pick him up or maybe come close to him, maybe try to tickle him, that kid will never ever like. Okay. These are the kids who actually withdraw from the touch. Now, one of the basic thing is that when the child's hand gets messy, or maybe while eating, if the mouth gets a little bit messy, you can see straight away they have to clean it up. They really don't want to be messy. So that gives an indicator that the kid is really very hypersensitive to the touch. They really are, avoiding different textures. Like it is very difficult for the parents to make them wear the socks or maybe the woolen caps in the winters, or maybe if there is a little drop of water in their shirt or in a trouser, they have to change it at the same time. And the most important is that these kids, the hypersensitive kids, are mostly very fussy eaters. They have a very restricted diet. There are a lot of other examples of giving. So we have a very good profile. You can just write it down if you want to write it down. It's known as Winnie Dunn Sensory Profile. WINNI. So Winnie Dunn, DUNN. So there are a lot of sample questionnaires which are available in the Google. So you can just go through it if you want to take out the printout of it, and if you want to check out the things, the sensory sensitivities about your kids. So just that's the perfect, because I'm using the Winnie Dunn profile with my kids. So that is the hypersensitive kid. But on the other hand, if we talk about the hyposensitive kid, remember the kid who had a fracture and he was not even bothered about it. So he was a hyposensitive kid. So here the situation is entirely different. Here the child is not bothered about what is in his hand. He is completely unhygienic child. He is a child who is actually, when you will see him now, you will see that he is a little bit of a child who wants to be dirty. So there are lots of those things which is happening with those kids. And these kids, as I have told, that they are not noticed if somebody has touched him. They are not even bothered about it. And these kids are really very slow responsive. So their touch system is very slow responsive. Like, supposedly, if some ant is crawling in my hand, so quickly I will just remove that thing, or maybe any insect which is crawling in my skin. But these kids, I actually don't know about it, that there's something is crawling in the skin. And sometimes they also get bite, or insect bite, or maybe you can see, if you want to see, you can see lot of blackish skin formation in their shin bone, in their tibia bone, and you can easily judge that they don't have a good tactile sensation about it. Okay, so this was an example of if a child is overreactive or hypersensitive, or maybe if he's a hyposensitive kid. Now, here I just want to include one thing. As a parent, we are very ambitious to put our kids in the school as early as possible. So imagine, let's do a sort of a case study. A child who has been diagnosed with an autism spectrum. The parents really have no idea about the sensory system. And the two problems which a child is showing, that he does not want to come in anybody's lap, or maybe he does not want to come near to anybody, and he really withdraws the touch. Imagine, we are just imagining a case, and suddenly we just, as an ambitious parents, or maybe as an ambitious therapist, you told the parents, okay, just put this kid in the school, and you have put that child in the center of 30 other kids who are going to sit very close to him. Maybe they are going to touch him. Maybe they are going to push him. Imagine how much torturous the kid is going to be. So that's the reason when the parents are coming to me and they are saying, sir, is my kid ready for the school? The primary thing I do is a sensory assessment to see if the sensory environment is troubling the kid or not. Okay, so now let's move further. That was a tactile system. So again, auditory, I just want to skip. I just want to skip the visual. I just want to come to the vestibular system. Now, this is again, as I told, this is my favorite system. So a child who is hyperactive has no knowledge of the space. So these sort of kids. Okay, let's talk about. Okay, let me change the slide. Okay, this is the fine. So these sort of kids really want to be on a space. So they are keep on jumping on the floor. The moment you put them into a trampoline, they can really touch the ceiling, isn't it? When they go to the playground equipments, the parents are so scared. He can fall anytime. He's so excited to go up. When the child is swinging, he's swinging so high that the parents are really scared. So this gives us indicate the vestibular system is really working, is very hypersensitive. So that is the thing. When the sensitivity is higher, the kids needs more and more and more of movements. Then this becomes a hypersensitivity. You know what? Here, I just want to include. I hope that there are a lot of professionals, especially the occupational therapists, the physios, and the speech therapists who are attending this conference. Let me tell you one thing. As a therapist, don't take this system as a joke, because this is the system which is a very dangerous system. It can really disorient the kid more. Because why I'm saying this, while visiting all through the country, one thing I have seen, every child is given a swing. Every child is given a swing. Every child is put on the gym ball. Every child is given a trampoline jump, whether they need it, whether it's gonna make them hyper or not, we don't even think about it. Our duty becomes, and this is what is happening at home also. So when I give a home plan, the common thing I see is, okay, what equipments do you have in your home? So we have a gym ball, we have a trampoline, we have this jumping thing, we have those jumping things. So this is the thing which I really want to say. If the child is on the hyper side, this system needs to be worked very, very carefully. Okay, so as I've told about the hypersensitive vestibular system, so now let's talk about the opposite, the hyposensitive kids. Now, there are lot of autistic kids who have delayed milestones. Now it is surprising, but yes, this is true. Because when we try to assess them, and when we ask the parents when did he started walking, the parents say he started walking maybe in the 18 months or it was 20 months. No, that is not normal at all. So that indicates me that this autism is not a hyperactive related autism. This is hypoactive related autism. That means here the vestibular system is not excited, it is in fact very dull, so dull that it's not even touching the threshold of so that the brain should be able to calculate the movement. You know what, let me tell you, because I'm dealing with a lot of the kids, hyperactive kids are very easy to teach. Hyperactive kids are very good learners, but if the kid is on a hypoactive kid, if the sensory system, especially the vestibular system, is really very down, then making them learn is very difficult. So that is one of the things. So these kids, the traits they basically show is that they want to be in one place. They are lethargic. So when you will leave them because of the stimming, you will say that they are hyper. But the moment if you will tell them, okay, let's come do something, you will see that they become lethargic. These sort of a kids have a very poor muscle tone. So if these things are happening there, so that means your kid is having a very low stimulation over the vestibular system, and the treatment protocol really needs to be made upon knowing this thing. Okay. Now the third system is the proprioceptive. I think I really explained you this system so well. Remember the sac wala example which we did to give you the indication about how the muscle and the brain works together without if there is a stimulus or not. So, if the proprioceptive system is poor, the only thing you will see is the low muscle tone. Now, the low muscle tone, basically, tone means a tension in our body, a tension in our muscle. There was a person in a chat who said that, okay, I'm following you in a YouTube and Insta. Well, if you have gone through my Insta channel or YouTube channel, I have explained this muscle tone very detail. In fact, I've explained all the sensory systems in very detail. So this muscle tone basically means the tension which I really need to have in my body. So that tension, why that tension is important to keep my brain activated, because brain also needs some input. Remember, if there is no light, if there is no light, you will be able to use the computer. No, you need to have, maybe your battery needs to be charged so that the computer should get switched on. So you need that charge. That charge is basically given by the tension in the muscle. So that is the muscle tone. So usually the kid who have a very poor proprioceptive system, their muscle tone is very poor, and it's very easy to see. These kids are, you know what, like down. And these kids, the one of the biggest example is their feet. Their feet will be completely flat. You can clearly see they will not have a good arch. In fact, they will have a medial weight bearing where their weight will go towards the inside. So that is one of the ways you can see the pencil holding is very poor. The time you will tell them to throw the ball, you will see that it's just like they don't have energy in their hands. So these things are basically which comes under the proprioceptive system. Okay. So I hope you understood three systems, because now we are going to go to the main thing, which is a sensory diet, isn't it? And I really want to talk about it as a parent, as a therapist. It's very important for you to know what is the meaning of diet and how the diet should be made. Okay. You know what? Surprisingly, you will be surprised when I just put this video and in my YouTube about the sensory diet. I received a question from the parents, sir, is it something to eat? Is it sensory thing which we have to eat? No, it's not a sensory thing to eat. It's basically you need to see the child. So let me come to the definition first, then I'll make you understand. So it is a customized sensory plan. Customized means that sensory diet of each and every child in the spectrum will be entirely different. And what are the things which will decide what type of a sensory diet the kid needs? It's completely the sensory system. So, first, you should be able to clearly identify the sensory issues of your kid. You know what? If you really don't know why the child is stimming, whether it's a visual stimming or it's a proprioceptive stimming, there is no point of making a sensory diet, because to make a diet, you need to the primary goal is basically to make a diet in which the child should be able to settle his primary system. And remember the three primary systems: tactile, proprioceptive, and vestibular. So, my sensory diet, when I make a sensory diet, okay, let us do a case study again. Let me give you an example. A child came to me with an upward gaze. He has an upward gaze. So the child came to me and I saw him that he is just sitting like this and his eyes are always looking upwards. And so I asked parents why he's looking upwards. So the parents told me that, sir, see, he is very fascinated towards the movement. And so he is very fascinated towards the fan and he always keeps on looking the lights, because obviously the lights are on the top. So he prefers to keep his head up. I will not make a visual plan. I know that he is visually stimulating the things. You know what? My plan will basically work on the vestibular system. I will work more on the balance system, because when I'm going to put him into the balance system, automatically the eyes are need to come down. So are you getting my point? So that's one of the things. So that's a reason. No matter if you have a visual stimming, you need to come to the vestibular system where you need to challenge the balance. The moment you are going to challenge the balance of the kid, you will see the vision is automatically going to come down. The vision is automatically going to come in the center, and that's where the visual stem is going to come down. And secondly, my goal will be to give him the heavy work. So imagine a child who is standing on a balance board, and so he is completely integrated. And then I told him, okay, now you have to pick up 2 kg of a ball. So when he's picking up 2 kgs of a ball, amount of integration of the body he needs, the vestibular and the proprioceptive system, which he needs to integrate. Again, I worked on the vestibular and the proprioceptive system, and I see the result that the upward gaze reduced, the visual stimming reduced. So again, depending upon the issue of the child, the sensory diet needs to be made. So making the primary tactile, proprioceptive, and a vestibular system as a base. Okay. Second thing is, I basically see what type of a stimming the kid is having. So supposedly, if a child is having a flapping, an excessive of a flapping, so my sensory diet will be more on training the shoulders, more on training the wrist activity so that the flapping can come down. And imagine if a child who is coming to me is just keeping his hands like this because he does not want to open his hands, he does not want to explore the things. In that case, my sensory diet will be more focusing on the tactile system. And in case if a child who is coming to me who has a lot of a visual stimming, so my sensory diet will depending upon his issue. So you can see it is a customized thing depending upon the stimming, the power of the powerful stimming the child is having. So that is the thing. So again, sensory diet is a thing which needs to be made depending upon a child. You know what? I have been, again, as I have told you that I am really visiting all the states of our country. There is a one sensory diet which each and every therapist is following. इसको 10 times jump करा देना, 20 times bounce करा देना, इसको deep pressure दे देना, इसको brushing करा देना, इसको थोड़ी light दिखा देना, इसको ये कर देना, इसको वो कर देना. That's a sensory diet. So again, they are just working on the standardized program. It's not a customized sensory diet which they are focusing on. So my basically request is that whenever you make a sensory diet, it's very important to know the sensory systems. Now, if you are a parent who is attending this conference, I have made a very good videos on the sensory system. You can just go listen to it. I think you will be able to understand your kid better. Secondly, if you want to understand the sensory system of your child, go to the Google, get the sensory profiles. There are a lot of sensory profiles. Get the copy of it. Just start ticking the things your child is showing the issues. You will come to know whether your child is defensive or he is a seeker, whether he is a hypersensitive or hypersensitive. So there are lots of ways of doing the things. It's all about getting educated about the things. And always be in touch with your therapist. After every session, the therapist should be very satisfied. Okay, today, whatever I did, it really worked on the kid. And the parent should be satisfied. Okay, whatever happened today, I loved it. No matter if there is a development in the kid or not, but I loved it. This is what my child needed. So this is the thing which is very important. And the third very important thing about the sensory system is that the sensory diet is that it needs to follow throughout the day. So, Nandita and I used to work in the same school in Vasant Valley School, which was very open towards the special need kids. And we were having that freedom that the kid can put a weight cuffs in the class. If he is having a sensitivity, he can just keep a headphones in the class. Or if he is having any sort of a problem, so if you want to have a gym ball where you want to make him bounce, you can do that. So every school should be so sensitive, because when we make a diet, everything needs to be given in a certain intervals. Maybe if a child is too auditory sensitive, then I will say the parents, okay, the music therapy needs to be happen every 3 hours for 20 minutes or maybe 10 minutes. So supposedly if at that time the child is in the school, so that protocol will not be able to be followed because school is not allowing the things. So then it becomes very difficult the parents to follow that diet. So the schools also needs to be very sensitive regarding. They should understand the issue of the kid, and they should, the diet is a thing which you have to follow throughout the day if you want to reduce the sensory issues of your kid. So I know it's very easy to speak in front and giving such a good lectures and making the things very excited for you. But trust me, it's not so easy while we work. It is a very, very difficult journey. But let me tell you one thing, there is no child who does not develop. Each and every child really develops. Each and every autistic kid can really become independent depending upon the level of intellectual thing which he has. But yes, every child develops. Okay, so this is enough because I had just a time for 45 minutes, and I think I have taken just 45 minutes because 15 minutes is for the question and answers. So it's completely up to you. I'm just going back here.
So thank you, Dr. Roshandeep Bagga, for the information. There are a few questions from us and the participants. I can read aloud for you.
Yeah, sure.
So first question is from Mr. Prashant Nair. He said, my 22-year-old daughter is obsessive about music and holding objects and tapping it. Any specific method to reduce it? Listening to music using headphones from
Again,
YouTube?
obsessive about the music and
Music and holding objects and tapping it.
okay. So see, Prashant, the thing is that I'm talking about a 20-year-old kid now, so he's an adult. So let's understand one thing. If you are not able to solve the sensory issues till the age of 9 or 10, so it becomes a behavior. Okay. So no matter how much you're going to work on the sensory system, now it's a behavior. Now the things have been embedded in his mind like nothing. So he will do it because it's just like a normal phenomenon of his life. So you can't stop it. Even we can't stop it. But talking about this, one thing which I just came to know is that your child is really having the auditory sensitivity. Like he seeks the sound. So what is happening is when you are putting that headphones in his ears, the temporal region is getting stimulated. So he is feeling a sort of a satisfaction. But the moment when you remove something, he just wants to hear something. So he just starts tapping the table or something like that. Because what he needs the sound every time, all the time he needs the sound. So that is what is happening with him. So this is like he's seeking, he is a seeker, he's an auditory seeker, what he is doing. So maybe if you want to go for a music therapy, a very intense music therapy can work for your kid. Secondly, what I would say that make your child do the physical exercises because he's a 20-year-old kid, at least for 2 hours daily, so that his energy gets channelized. Because the moment the energy is going to get channelized, all the sensory systems are also going to get settled, including the auditory system. And the third thing is, usually what I say is that this auditory stimming is not comes isolately. So there may be some other stimming issues also, maybe that he loves something to move or something like that. So just go through it. And I don't think so OT is going to make much effect now, but increase the physical exercises. Start with a music therapy. This might really relax your kid a lot.
Okay. Another question from us. Visual seeking behaviors are commonly seen in children with ASD. Can prolonged exposure to gadgets contribute to or worsen these behaviors?
Absolutely, absolutely. See, why I want to say is, and supposedly if the uh, if the visual has been given in the early days of his development, like I know you're talking about the mobile. See, what happens is basically in the age when I'm talking about a 2-year-old or 3-year-old kid, where he needs to keep on running around and explore the environment, he's not exploring the environment. So he is in front of the screen. So what happens is one of my sense, which is a visual sense. So my visual cortex is getting stimulated, stimulated, and stimulated. But all the other senses, maybe the touch, the vestibular, the proprioceptive, the auditory, these are not getting stimulated. So what happens is that one sensory system, so here the visual system is taking all the other systems. So all the other systems are not developing, and one of the system is developing like anything. So this creates an imbalance in the sensory systems. So this thing, the screen thing, or maybe if you're watching the excess of the things, will really stimulate the visual thing. And yes, this can be one of the reasons of visual stimming, because as much, see, when the child is grown, he has nothing in his brain. So brain is completely blank. And supposedly, if you have feeded him with the visual, and visuals, so the whole brain is modified with that visual thing. So that is one of the reasons that a visual stimming can come if you're exposing him to a lot of visuals and screens.
Okay. Now, Manjari is asking strategies for disciplining child with sensory issues.
Now, again, Manji, I want to ask what sort of a sensory issue? We have a huge thing. So, what type of a sensory issue you are talking about? You are talking about whether your child is tactile sensitive, or maybe he is feared of heights, or he has a low muscle tone. So, what type of a sensory issue? It's very important for us to clarify this thing. But on an average, I know we don't have so much of a time. As I have told you, no matter what type of a sensory issue it is, check the tactile system. So, if you feel your child is defensive, or maybe he's like seeker, so you have to work on the touch system. So do lot of touch system activities, the tactile activities. Do the basic activities, like your child should be able to independently come up and down the stairs. He should be independent on all the swings. He should be able to balance himself in the balance board, the small beams. He should be able to easily transit from one surface to the other surface. So those are the things to check the vestibular system. As well as you need to see if your child is having a very poor postural control and he's not sitting in one place, and when you're giving something he's not having that power. So do lot of heavy work exercises with him. So working on the tactile, working on the balance system, working on the muscles, this is a basic thing which you have to do.
There's a question from Amrita Ranganath. How do I interpret Winnie and sensory profile scores?
Hi Amrita, how are you? I hope Nandita also knows her. You know what, you have to be specialized to interpret that results, because it is a very complicated thing. You need to get training for it, because, and the unfortunate part is that it's only occupational therapist who can get the training about it, because it's specifically tool which is used by the occupational therapist. So we have two things. We have one questionnaire which is given to the parents or maybe the caregivers, and then we have one key. When the questionnaire comes to us, we just make all the calculations to see what type of a sensory issues the child specifically is having. So the thing is that you need to have a certified sensory integration therapist for it, and a therapist who is trained in the Vinay sensory profile. Then only you'll be able to solve the keys. Otherwise, just fill it and just use your brain, what type of a sensitivities there can be, and start working on it.
Okay. And there's a question from Mukta. My son is 24 years and is obsessed with elevators. Is this seeking vestibular or avoiding?
Well, ma'am, see, if he's obsessed with elevators, I would put it into the vestibular system, but there is a probability that he is seeking the visuals also. But 90% there is a probability that he is seeking the vestibular thing. You know what? I would suggest you, I know he's a 24-year-old or 20 years, above 20 years, have a swing at your home. Not a very big swing, a swing which do not move so much, but a very minimal amount of movement in a swing. Tell him to sit in that swing. Let him have it for 15-20 minutes, 3 to 4 times a day. This might reduce his urge of looking at the elevators or something like that. But again, it's a very confusing thing. Sometimes what happens, he loves that elevator wala sound. So if he's auditory and he loves that sound, elevators ka, so it can be an auditory thing also. But more or less, what I believe, it's related more to the vestibular system.
Now there's a concern from Swati Chitra. My son, 6-year-old, has problem with standing still when we ask him to wait for even 10 seconds. His body keeps on moving and also has problem with visual sensory issues like staring and can't focus on his activities. He easily get distracted. Please suggest a solution for this.
So the definition is that your child is hyperactive, first of all. Okay. So now he is not able to stand at one place, or let's see, if he is hyperactive, what I believe, you need to channelize his energy. So this is the first goal which you have to do. So do a lot of heavy exercises with him. So you have to make him organized first. They should have that muscle. As you said, he is not able to stand still. Maybe a balancing exercises where he has to really shift his weight from one place to the other, or you can do it even on the swings where you can just make him stand at one place, move a swing a little bit, and tell him to do the activities, because that vestibular input is going to give that interest to him that he should be at one place. So anything which you have to make him stand at one place and make him do lots of activities to make his posture normal. And remember one thing, let me be very clear, because we didn't cover this thing in our work in this workshop. It's not only that physical exercises and the sensory systems are going to reduce the hyperactivity. Work a lot on his cognitive sense, maybe working on the fine motor sense, or maybe working on some pen pencil activities with him. Make him sit on the tabletop and make him do the activities are also going to reduce the hyperactivity. So work on the sensory system, do lot of fine motor activities with him, do lot of play activities, like just keep on playing with passing the parcel with him, because if you'll put some music and if the light, so that tends to relax a kid a lot. So you can just sit and start playing passing the parcel, musical chairs with him, maybe do lot of play activities with him. Don't try to force him to make him sit down, but work on the sensory system, work on the cognitive system, and work on the play skills. That will definitely reduce his hyperactivity.
There's a question from Joseph within. What sensory diet can be advised for a child with excessive hand flapping? Also, my 12-year-old son with which is ADHD like to touch face and stomach and enjoys irritating. How this can be tackled?
Okay, thank you, Joseph. It's a very specific question which you have asked. So let me give you a little bit of a strategy so you'll come to know. See, a child who's flapping a lot, the primary thing which we have to do is to work on the shoulders, because what this flapping has done is that has really reduced his abilities of fingers to walk. So all you need to do is work a lot on the shoulders. So just try to work on the shoulder strengthening exercises. Maybe if he's a big child, you can use the dumbbells and all those things, the pulleys and all those things, to introduce lots of muscle toning in the shoulders. And secondly, The same thing which you have to do is to do a lot of strengthening in the wrist. Again, you can do it with the dumbbells and all those things. And third is you need to work a lot on the grip and the grasp. So just make him hold something heavy like a bucket or something like that and tell him to walk so that he can get a good amount of proprioception in the fingers, in the wrist, and on the shoulders. So primary work on the shoulders, on the wrist, work on lot of grip and grasp. So when I'm talking about grip and grasp, we have a palmar grasp, we have a hook grasp, we have a lateral pinch grasp. So just go through the net, look for the different grip and grasp things, and you will find the activities according to it. Keep on working on it, and you will see that there is a decrease in the flump.
Another question from Manjari. What is the recommended frequency and duration of the therapy sessions? I have had experience in the past where my child was given a very intensive plan, going daily for different sessions, and I wonder if that was also a bit too much for a child having sensory issues.
Ma'am, see, this decision has to be made by you and your therapist. I cannot say anything while sitting here. It all depends upon how much. See, it depends upon few things. If you feel that your child is not in your control, the primary thing. So sometimes the parents come to us and say, sir, see, practically he is not ready to work with me. So just make him ready to work with us. So in that case, if the child is not working with you, I think the intensity of the therapy will be more. Secondly, about the issues, there are a lot of issues for which you need a lot of occupational therapy equipment, which practically is not possible for you to have it in your home. So what will happen is then you need to go for the therapy sessions there. Third, very important, and please don't take it negative. It depends upon how much time you are giving it to your kid. So you know what happens. I'm in a metropolitan city, and here the parents have a mentality because money is not a problem for them. They come to us and कहते हैं कि okay sir, just take 2 session, 3 session, 4 session, doesn't even matter for us, because they want to avoid to give time to their kid. So if you're a dedicated mother, I think once a session in a week is also enough, 2 sessions in a week is also enough. So this decision has to be made by you and your therapist depending upon the issue of your case.
Another question from us. In some children, frequently touching their private parts may be related to a sensory need. However, in other cases, it could be a response to unsafe or inappropriate touch they may have experienced. How can we differentiate between behavior driven by sensory needs and behavior that may be a sign of trauma or abuse?
Okay, there are two reasons. According to sensory perspective, I'm not a behavior analyst and I'm not going to talk about the behavior right now. So the two things which I basically see is when is he touching his genitals. So one of the time can be that he always does it. So what he does is that he just keep on lying down and start rubbing himself, and he can do it for hours and hours, and he is really sweating. In that case, I think it's a proprioceptive need. On the other hand, he is stimulating his genitals when he is getting excited. So whenever he's getting excited, he keeps on pressing his genitals. In that case, it is coming only when he's getting excited. So this is a sensory issue. But here, the behavior strategies are also going to come where we need to teach him to get relaxed. There are other ways of expressing yourself. So don't get excited about it. So if the child is doing it for hours and hours, he is getting sweating, so it can be a proprioceptive need. But if he is doing only when he's getting excited towards anything, so it's basically a lack of language. It's basically that he does not know how to express himself. So maybe in that case, behavior strategies can also work with proprioceptive exercises.
Thank you, doctor. So for the some rest of the people like Amrita and Ganathan, they'll email you the answers as we are winding up right now. Thank you, Dr. Roshandeep Bagga, for leading such a meaningful and insightful session. Your insight brought greater clarity to both families and professionals in navigating sensory integration. Thank you.
Thank you. Thank you very much.
Thank you so much, sir.
So I'm leaving right now. Okay.
Just an announcement. We will start our next session at 11:15. So if you want to have a small break, you can all go and come back by 11:15.
Birinder, do you want to do audio video check?
Check.